Pakistan's Federal Board of Revenue has launched a major money laundering investigation involving a pharmaceutical company. With alleged transactions exceeding $7.5 billion, authorities are examining financial records and payment channels to determine whether illegal activities were used to conceal funds. The case is raising serious concerns about transparency and accountability within the pharmaceutical sector, which plays a critical role in public health. Experts warn that financial misconduct in this industry can disrupt supply chains, inflate costs, and ultimately affect patient access to essential medicine. A joint operation by the Federal Investigation Agency and drug regulators has uncovered a counterfeit medicine factory, exposing a dangerous, illegal network operating within the pharmaceutical supply chain. Authorities seized large quantities of fake drugs, many of which could have posed life-threatening risks to patients. Health officials warn that counterfeit medicines not only fail to treat illnesses, but can also cause serious harm or death. The incident highlights significant weaknesses in regulatory oversight and enforcement, prompting renewed calls for stricter monitoring and tougher penalties against those involved in such operations. Authorities in Punjab are racing to investigate the deaths of 7 children in a village in Rahim Yar Khan, an incident that has triggered widespread concern about a possible disease outbreak. Medical teams have been dispatched to the area to assess the situation and identify the cause of the fatalities. Early concerns point to delayed diagnosis, limited healthcare access, and weak disease surveillance systems in rural regions. Health experts warn that without timely intervention and improved infrastructure, such incidents could escalate quickly, highlighting the urgent need for stronger primary healthcare services. Health experts in Pakistan are warning of a looming man-made epidemic driven by the continued use of unsafe, reusable syringes despite an official ban. The Pakistan Medical Association says falsely labeled syringes are still circulating in the market, contributing to rising HIV and hepatitis infections, including among children. Experts are calling for immediate nationwide audits of manufacturers, strict enforcement of regulations, and public awareness campaigns to help people identify safe medical equipment. Without urgent action, they warn, the country could face a major public health emergency fueled by preventable infections. Sindh's healthcare system is facing a serious structural crisis, with more than 75% of top-level technical positions lying vacant. This leadership vacuum comes at a time when the province is battling multiple infectious disease outbreaks, including HIV, measles, dengue, and mpox. Experts say the absence of experienced officials has disrupted planning, surveillance, and rapid response mechanisms that are critical during public health emergencies. With promotions delayed for years and no new inductions planned, concerns are growing that the system may struggle to contain future outbreaks, leaving already vulnerable communities at even greater risk. Pakistan's Drug Regulatory Authority is preparing to release a nationwide pricing survey following widespread complaints of sharp increases in medicine costs. Reports suggest some essential drugs have become up to 80% more expensive, placing a heavy burden on patients, especially those from low-income backgrounds. Health experts warn that rising costs could force many people to skip or delay treatment, potentially worsening health outcomes. The survey aims to assess the scale of the issue and guide policy decisions, but concerns remain about long-term affordability and access.